Visant, transforming healthcare through pharmacy.
Hi, I'm Erick Siegenthaler, and I'm our Senior Director for Infusion Strategy at Visant. Hospitals and health systems, infusion clinics are a very important part of the overall pharmacy department, both from a patient care standpoint as well as a revenue standpoint. So at Visant, on our infusion strategy and optimization team, we really look at encouraging organizations to look at their entire infusion portfolio. Many organizations may be providing medications in physician offices, some dispensing medications through their specialty pharmacy, and others potentially through home infusion. We encourage organizations to look at that entire bandwidth or the entire continuum of infusion services provided, really dive in deep to understand what are some of the challenges being faced, as well as what are some opportunities to bring all the pieces together. Historically, I think pharmacy has been part of hospital infusion, but primarily maybe from a revenue cycle standpoint and a drug fulfillment piece. What we look at is really the overall strategy. How can we drive more services into the hospital infusion clinic? How can we support providers and referral sources to get those patients into the clinic? How can we open up bandwidth to get patients in chairs in a timely manner and bring all of that together? At Visant, I think one of the differentiating factors that we bring is being able to provide experts in each of the areas that really touches infusion and the pharmacy standpoint around infused drugs. So we've got our specialty pharmacy team where more medications are maybe moving to a pharmacy benefit, or we are working on white bagging challenges. We've got our 340B team to look at 340B drug pricing programs and how we can ensure that patients are getting their medications and that we're purchasing them at an appropriate price and compliantly, as well as our revenue cycle team. So bringing all of those pieces and some of the other areas in Visant together can be really helpful, and we often see organizations reap the benefit through care coordination and patient care, as well as financially. Some of the challenges that we see, though, surrounding that are, white bagging, for example, where payers are forcing infusion clinics to receive drug from an outside pharmacy. And we can look at that on our team and understand how can we support that through payer contracting, or how do we improve that process to reduce the loss of revenue through those white bagging programs. The other area from infusion that we see is site of care restrictions, where payers are mandating patients to leave hospital-based clinics and receive their care in a lower cost setting. So that may be a physician office location, an infusion suite, or maybe the home setting. So what we look at from a Visant standpoint is we come in and understand, are there opportunities to improve services in your hospital, which is really the traditional place where patients have received their infusions? And is there an opportunity to maybe grow through developing infusion suites or home infusion, which often can help alleviate those challenges from a site of care and white bagging standpoint? And at the end of the day, what we look at is there's a right place for each patient, whether that is the hospital or it may be the home. And each of those options should really be available to patients within health systems to provide the total breadth of care from an infusion standpoint.
Visant. Visit us online for more information.